welcome to Healthy Kids Corner with me, Dr. Brooks. This week I just want to take a few minutes to talk about reflux in infants, seeing that I've had a few new babies come in and I thought to myself, I have not done a video on this yet. So I just want to chat with you a little bit. So typically when we have parents that have children with reflux, they have gone to the pediatrician because they're unable to keep their food down. They may or may not be actually vomiting or refluxing up food. They're not really gaining weight, might be another concern. And this is really common to see it come on, or the onset of it start between 3 and 6 weeks. And in some infants it starts just after a couple of days of birth. And typically they are prescribed reflux medications like Zantac or Prevacid and given a diagnosis of gastroesophageal reflux disease. Now, this is something that they may or may not have. There's really nothing really going into the testing per se. It's just that when you take them to the pediatrician, of course, they want to help a new mommy with a very uncomfortable baby at home. Of course, you can imagine if they are refluxing, they are really uncomfortable, very colicky, not sleeping well, not eating well, nothing seems to be going right? So, of course, the pediatrician wants to give you some sort of answer, and this is really, from a medical perspective, the answer. If a baby is colicky and uncomfortable, they must be having reflux. And in some cases, they call it silent reflux, right? So, here's my take on it. The previous generation called it colic. So, and really, there was nothing done about it. It was, your baby has colic, and there's nothing that we can do. Now, we say, well, your baby's uncomfortable, they probably have reflux, so let's give you a pill and give you the diagnosis of reflux and send you on your way, and let's hope it works, right? And truly, a very small number of children actually benefit from the medication, unfortunately. So they've done some studies, and they said that fewer than 10% of the kids actually have reflux when they did their swallow studies. When the swallow study was actually performed, less than 10% of them actually had reflux. So Pediatric Journal basically told docs, hey, that actually might not be reflux. We actually might want to think twice about using this medication for little infants. I think I've had kids as early as 8 days get put on these medications. I think when you go to the doctors, you want answers, and that's understandable, right? You have a newborn at home, you're miserable, no one's sleeping, but the diagnosis of reflux may not be the answer for you. So let me offer just a different perspective. Parents, again, usually see symptoms of reflux and possibly colic, right? The first 3 to 6 weeks is when I would say, just based on my experience, is when parents say everything was going fine, and then at 4 weeks old, things just went out the window. So I think a lot of times this is when kids just become unbearably comfortable. They can't really deal with the pain. They don't know what to do with the pain. So many of these cases of reflux or colic are really caused by restrictions that they have due to improper birth position, a birth trauma, multiple births, like twins and triplets and such, and then some are just diet related. Chiropractic care can be immensely helpful for these babies, along with craniosacral therapy. I use craniosacral therapy on the newborns for reflux, and knock on wood, I've been able to help every single baby thus far, because those children didn't really have reflux, right? They had other issues going on that we were able to alleviate. Supplements can be helpful, like probiotics for infants. And then, of course, what is mom taking? What is she eating, and what is she taking if she's breastfeeding that may be making the baby more digestively uncomfortable, giving the baby gas, etc. If a mother is formula feeding, the thing that we need to ask them, is it a dairy or soy-based formula? If so, we may want to think about switching. Those switching options could be goat milk, which is actually really great, but you'll want to get with your doctor because there'll be some things you need to add to it. And then another option for a formula that is a gluten, casein-free, hypoallergenic is Neocate and Elecare. Both are extremely expensive, so I'm going to caution you. However, when it comes to the health and happiness of your child, I think it's worth doing. That's why some parents choose to do goat milk, because it's a little more affordable. So I touched upon the fact that reflux or colic could be due to some discomfort from foods that a mom's eating or formula that a baby is getting. It could be due to some restrictions, and I want to talk a little bit more about that. When a baby is in utero, there could be some positioning issues that the baby's having, and in turn they come out with some restrictions that don't feel so good to them. Now, really gentle chiropractic adjustments can be made with your fingertips that really help these babies. I find that what helps them more is the craniosacral therapy portion of chiropractic care. And that's really where you're working with the soft tissues and the cranial bones, because all the bones have to kind of squeeze together, or it's called cranial molding, in order to pop out. If it's a cesarean, sometimes they don't get to go through cranial molding at all, and that can be another issue. So whatever means they came out into the world, those cranial bones either go back to where they should be or they don't. And when they don't, that's where you get some cranial restrictions that can be alleviated very, very gently and can bring them immense joy and happiness. In that, you have a colicky baby who doesn't cry anymore. You have a baby who wasn't pooping that is pooping. You have a baby who wasn't sleeping that is sleeping. You have a baby who couldn't latch when they're breastfeeding well that's now latching and feeding great. So these are all things that can be helped with craniosacral therapy. I did do a YouTube on craniosacral therapy, explained a little bit more in detail about it, as well as I'm working on an infant in that video, so you can see that video as well. The other one, like we called diet changes, right? We went through the goat milk, we went through the Neocate and the Elecare. Again, with the Neocate and Elecare, it is very expensive. So if you find that is something you're open to switching to, you may want to get with your GI doctor if you have one, or your pediatrician, and ask them if they will write you a prescription for it, and see if your insurance will then cover that, because it is prescribed by the doctor, because they cannot handle cow milk or soy. Both are very irritating to infants because the proteins aren't able to be digested by infants. I go into a lot of talk about this in my book, 15 Things Your Doctor Doesn't Know About, which you can buy on our website, on Amazon, Kindle, iBooks, all that fun stuff. So if you want to read a little bit more about first foods and digestive issues in children, I talk a lot about that there. As far as what to expect with chiropractic care, I would tell people it usually takes 4 weeks to several months, depending on the age, the complexity, and the underlying issues. So it's really important that if improvement's going to be seen, that you follow the recommended treatment plan by your chiropractor. And if your child is struggling with reflux, we might be able to help you if you're in our area, or refer you out to another doctor. What you'll really want to do is be kind of geared up to really see Improvements can really be seen quickly when the treatment plan is followed. For instance, I typically see babies, or children in general, twice a week for 3 weeks, and then I'm hopefully far enough along in craniosacral therapy to move them out to once a week. And that could be for 6 to 8 weeks, just depending on how restricted they are. I will tell you, I just had a reflux baby in, and it was her 3rd treatment today, and she hasn't had reflux in a week. So it can be really, really quick. Now, does that mean I'm done? No, that doesn't mean that I'm done. It just means that we're making some really quick progress, which is great, but those restrictions really have to finish being removed. And that's why you have to stick with the treatment plan that your doctor gives you, because what will happen is they'll regress right back to where they were if you just don't get rid of all those restrictions. But then again, I've got that YouTube video on craniosacral therapy, so see that for what does restrictions means, all that fun thing. So I go into a lot of that detail there. That wraps up reflux for the day. If you would like some more education, we do parent webinars for free for any parent that wants to attend every month. We also do clinician webinars. You can see listings for both at dramberbrooks.com. We're also on Facebook at Whole Child Wellness, where you can follow us there, and I like to post things there that will be helpful to parents in our practice as well as others. We're on Twitter at WholeChild4U, and of course on YouTube here on our channel. We've got lots of other videos that I hope you enjoy. Like more information about my practice, you can visit mychildwellness.com, and you can contact our office if you'd like to be a patient. So have a great day. I'll see you next week. Thanks for joining me. Bye.